The U.S. has officially administered more than 300 million coronavirus shots since President Biden's first day in office. That's according to the CDC's latest count. As of Friday afternoon, more than 45% of the population is fully vaccinated. Nearly 54% is at least halfway there. But the pace of shots is still lagging as the nation races to get ahead of emerging variants. And according to the CDC, more than 14 million people have skipped out on their second dose. For more on all of this, let's bring in Dr. Henry Bernstein. He is a pediatrician at Cohen Children's Medical Center. Dr. Bernstein, thanks for being here. You are also a member of the CDC's Advisory Committee on Immunization Practices. So I'm so eager to talk to you about the pediatric vaccine because it has yet to be made available in the U.S. for young people between the ages of, I understand, like 5 to 12. So talk to us about the approval process for this vaccine and how far away are we from having the pediatric vaccine available for these younger children?
Well, so it is exciting that we're able to offer the vaccine, as you know, for teenagers 12 to 17, which is exciting. We also, studies are well underway for the next group. It's called age de-escalation. So we're studying 6 through 11-year-olds and then 2 to 5-year-olds and then 6 months through 2 years. So these studies are underway and data from earlier studies are incorporated and evaluated very closely and intensely before making recommendations to use them through emergency use authorization. I suspect the younger children may not be available until sometime in late fall, early winter.
Late fall, early winter for that youngest group, the 6 months to 3 years or to 4 years, I guess it is, or are you talking about that group 6 to 11?
6 to 11, I think, will be sooner. That I would expect that to be somewhere in the late third quarter, fourth quarter of this year, and then going into the early 2022 for the younger age group, those under 5.
So remind us how the pediatric vaccine for all these different age groups compares to the vaccine that adults and teens have been getting. And can parents feel confident that when it's available that it will be safe for these younger groups?
Well, we should understand that the safety surveillance system in the United States by the CDC and the FDA has been historic. And these studies are also, every detail is being conducted and nothing is getting by. We do age de-escalation as well as dose de-escalation. So we test first the doses. As you know, those 12 through 17 are receiving the same dose as those 18 and older. And then the younger ones, their doses are adjusted accordingly so that we know that these are safe doses, yet enough of a dose to produce a protective level against the SARS-CoV-2 virus.
I want to ask you another question about this because some parents have been confused by the provisional approvals that these vaccines have been granted, and they're wondering if they need to wait or they feel cautious that they haven't gotten the full approval of the FDA, of the CDC. Talk to us about that concern.
Honestly, that's a very appropriate concern because generally, vaccines take years from the time that it's an idea to going through the various phases of safety and immune response. Then it's used in larger numbers from thousands to tens of thousands. And what has happened with COVID-19 vaccines is all the steps have been conducted the way they normally are, but the process has been accelerated because of the intense morbidity and mortality associated with COVID-19. More than 600,000 people have died. Pediatric patients, more than 4 million children have been infected with SARS-CoV-2. Over 15,000 hospitalizations, over 4,000 cases of multi-inflammatory syndrome in children. And there have been 400, 500 pediatric deaths as well. So all of the steps in order to make sure that the vaccine is safe and yet provides the protection that's necessary are being conducted very closely and monitored seriously and closely by both the FDA and the CDC.
And in the meantime, parents are wondering how vigilant they need to be about keeping their children safe, when these younger children, when they're not yet vaccinated. When are masks necessary for these children? What about when they're playing closely with other children on a playground? What about when they aren't close to others but are in an indoor situation like a restaurant?
So you've talked about a lot of different areas. Fortunately, as you know, outside is better with more ventilation, and there's less close contact with others, so there's less transmission. And as we know, the rate of transmission in certain parts of the country happen to be rather low at the moment, which is appropriate. I would hope that all the family members who are old enough to get the vaccine have been vaccinated, so that when the children are indoors, the chance of being exposed is lower. And certainly they should be wearing masks if they're in close quarters and are going to be close to people for extended periods of time, just to be sure that they're lowering their chance of transmission.
Well, as we mentioned earlier, vaccine completion, that is getting only 1 of 2 shots, is on the decline, according to the CDC. The completion rate has actually started dropping below 90%. So why aren't people following through and getting fully vaccinated? And remind us what the risks are of being only partially vaccinated.
Well, there's some real risks to being only partially vaccinated. We need to understand that those that are fully vaccinated are less likely to have problems if they are exposed to the virus. But those that are unvaccinated, the virus can really wreak havoc. And as you're well aware, there are also variants, meaning the viruses tend to be a little smarter than we are and try to circumvent our immune systems. And so it is important, for example, with the Delta variant, we know that those that only have 1 dose are probably only about 35% of them protected. But when they get both doses, that gets closer to 80 or 90%. So it is important to be fully vaccinated. So it's discouraging to hear 15 million people have not been fully vaccinated. We also know that there's a number of areas within the country and some of the states where the rates of vaccination are particularly low. And that in turn is a concern, because then the rate of transmission of the virus and these variants in particular could cause lots of illness and hospitalizations and even more deaths.
Dr. Henry Bernstein, thank you so much for joining us, and thank you for all that you do.
Thank you very much for having me.